Happy March. So this month is all about women, really. The 8th of March is going to be International Women's Day, and then the whole month is about ovarian cancer awareness. And I wanted to talk about this. So I wanted to talk about the fact that we are so scared of cancer, and I just want to really urge us not to be. And I know it's really easier said than done, but the way I look at this is this. We all have cancer cells in our body, really, we all do. And our body's immune system is what needs to tackle, or generally does, tackle these cells that are abnormal and gets rid of them. If we have a compromised immune system, this is where things can go a little bit off, and we can start seeing tumors forming, and therefore we can find tumors that may be cancerous. But with everything in health, we can prevent. So I wanted to talk about the things that maybe make our immune system more challenged, and sometimes that's the problem. Our immune system doesn't have the way to fight or recognize even these cells that have a different metabolic rate and setup. And then I want to talk about solutions, and especially prevention. So the immune system needs to be supported to work. We need to have the right nutrients, especially things like zinc are important, vitamin D, super important. And we want to make sure that we also have the right antioxidant amount in our body. So eating food that is high in antioxidants, like all the fruit and veggies, and of course within this realm there are many that are higher and lower depending, so you can find out which ones they are if you look at the ORAC list. They will tell you which ones are the highest to the lowest, and just enjoy that. Spices are amazing for antioxidants, by the way, so spice up your food. Then you want to look at, of course, nutritionally also still, you want to look at things that you can have that are good for you, some, if possible, organic. But if not, just have the best that you can have, because it's better to have them than not. So, better to have these veggies and fruit than none, right? That's very important. Then lifestyle, so managing stress, things like yoga. You want to do yoga to support your stress levels, meditation. You want to have purpose. So that you can feel relaxed in your life because you're doing things that make you happy. So manage your stress. See work in a way that benefits you. It's not this chore. It shouldn't be. I don't know, sometimes it is, but we have to just change our mindset around it, because otherwise it kills us. We have to find things we're passionate about, and if it's not possible at that time, just change your mindset. Because you might not be able to control everything, but you can control the way that you respond to things, and that's powerful to manage stress, really. Then you want to make sure that you drink the right water. So water from the tap is full of chemicals, rightfully so, otherwise we will get a lot of diseases from the bacteria that is found in water. But if you can get a reverse osmosis system at home, then go for it. And don't worry if you say, okay, well, but I'm removing all the minerals, because you either remineralize the water, or if you're having a plant-rich diet, that's not a problem anymore. So things like that. Learn what your immune system likes, right? As I said, the right nutrients, the right support with the stress management, and sleep. Sleep is key, because during sleep we repair. So it's very important not to eat before we go to bed, because you want to make sure that the body doesn't stress about or puts any energy into digestion, but actually gives the energy to the immune system to do its job, which is scouring through our body, finding things that are abnormal and dealing with it. The other thing is about prevention, right? You have to be savvy. You can't just sit there and wait until you are diagnosed one day. So for us women, it's really important to go and see our gynecologist yearly. You want to go for routine checks to make sure everything is fine. Not just when you have issues, but actually when you feel good and you know it's time to just have a checkup. That's really, really key. When you go for your checkup, do your smear test. And if you're in a country where smear tests don't automatically check for HPV, which is the case in Portugal, I found, then ask for it. Ask to be checked for HPV. If you're clear from HPV, if there are no changes in your cells, then you go back every couple of years to check again. If you have been found to have HPV or have any changes in your cellular structure, even if they're minute, you want to go every year. So there are those parameters to follow. Of course, not just in our gynecological area, but also go for your breast checks, do your blood work. blood works are helpful not only because you can see overall what your health looks like, but you can also check if there's any inflammation in the body, which is a good way to see if something may be off. So anything that is off and elsewhere in the body can affect any parts of the body. Now, a question that is always asked and will come up is, what if I have the BRCA1 or 2 gene? Should I go for preventative surgery to remove my breast and ovaries? This is a tricky one to answer because it's generally a conversation every person, every woman should have with their doctor. Because ultimately, it's a very personal choice and nobody should judge. I'm going to tell you what I think and what I would do, because what I think is not about judging, but it's what I would do for me, okay? What I would personally do if I had the BRCA1 or 2 is that I would not necessarily go for any surgery. I would make sure that I go for regular checkups every year and that everything is tickety-boo, everything is normal, everything is good. I would also make sure that I would eat the best diet, that I would have the best lifestyle that I can, that I would learn about what thrives, what makes me thrive, and do it, and then use preventative medicine and diagnostics to make sure that I don't get cancer. And if I got cancer and had that gene, then I would just have to consider what the chances would be for me to heal or to just remove everything, and what kind of options I have. I know I wouldn't do chemotherapy. I just know it wouldn't work for me. It's not something I'm wishing to put into my body. But I've been actually looking up and staying up to speed with things like immunotherapy. And one of the reasons I've been looking at these things is because Chef AJ just released a couple of months ago that she has lung cancer. And in her journey, she is exploring what could be the best option for her. And just like me, she's speaking very openly about non-judging and what she would do for herself. I mean, she has a clean diet. She eats plant-based. She looks after herself, and still she got cancer, because this can happen to any of us. There are so many reasons. So one of the things that she's doing is immunotherapy, and she's been really getting support and advice from amazing doctors, friends, and professionals that are not related to her friend in her circle, to get support, to really know what to do to get her body to work the best that it can. So immunotherapy is something that I've been looking at and seems to be working a lot better than chemotherapy for many cancers. And just like chemotherapy, immunotherapy is not working on all cancers. So you have to really choose. You have to see. You have to talk to your doctor. You have to study. You have to be very aware, because the thing is, the doctor should be someone you make a plan with, and not somebody that puts fear in you and tells you what to do. That I don't think is good medicine. So this is what I would personally do. I wouldn't go for it to remove everything. I wouldn't do what Angelina Jolie did, honestly. But I would definitely consider my options, and I would make sure that I live the best way that I can to prevent it. And then deal with it if it comes in a way that aligns. And I know it's scary, I know. But, I also am so acutely aware that we're not eternal, and we're not going to be here forever. And because I'm not afraid of death, I feel that if I had to make a choice between living a quality life, for a longer time, even if it's not years to come, who knows? Maybe the mindset is something that would really power up the body. I would want to do that rather than be sick because of medication that can just destroy your body, really, and then not have any quality at all. So that is the choice I would make for me, but that's not right or wrong. That's just for me. And I want to be candid with my women out there, because I think that we need to share with an open heart and without judgment and supporting each other. And if I were in that situation, I would want my women up here to be completely on board with it. And not because I think that the only way is natural. As I said, there are immunotherapies that work really well on certain cancers, and I would probably consider them, right? I'm not gonna be like, no, I would consider them, but after having done everything I can with different protocols help and see if there's any shifts or changes, because I also believe that certain things work because of the person, not necessarily because of what you're doing per se. Like, of course, those things are positive, but one person will have a bigger impact than another because of the way that their body is, and maybe the genetic setup and the response of everything. So judging something as good and bad just because of where it sits on the spectrum of allopathic versus naturopathic medicine, I find is wrong. And I've learned this really by practicing naturopathy, because I've been probably a little bit extreme and be like, never do something because I don't want to take antibiotics. I will never take antibiotics. But you know what? I had a UTI that I didn't even know I had, and it was exhausting me, and it could have gone into my kidneys, and they gave me specialized targeted antibiotics for 2 days that were drinkable at night, so that they'll go into the bladder and basically stay into the urine and kill the bacteria. It didn't mess up my belly. I took probiotics for the vaginal area, and I made sure that I looked after myself the way that I always do, but with taking antibiotics, making sure that I boosted up my probiotics intake from food as well, and I didn't have any side effects, and I feel great. And honestly, I'm so happy that I took that choice, that rather than maybe having to deal with a kidney infection. So we have to be smart. Modern medicine allows us to do amazing things that we couldn't do hundreds of years ago. So I don't want to poo-poo all over it, but we can't misuse it, overuse it, and only think that that's the only way either, because of course it just goes into abuse of it, which is the case. Actually, it's what's happening many times. So this is what I wanted to share with you, and I hope that you resonate. And if you are going through anything here, please share, be open, because I want this group to